Hospital management goes far beyond technical administration. It is not merely about managing resources, beds, or shift rotas. We are talking about a critical function that sustains the healthcare system from within. It is a complex discipline. Its goal is to align people, processes, and resources toward a single objective, providing medical care that is high quality, safe, ethical, and sustainable. Real impact on lives. Managing a hospital implies making decisions that impact patients' lives in real time. It means building environments where human dignity is respected, where every professional finds meaning in their work, and where clinical processes occur with order, support, and strategy. In this module, we will explore three fundamental axes. 1. Strategic planning and the organization of medical services. 2. Leadership and the optimization of hospital resources. 3rd, and finally, the role of hospital committees as key bodies for oversight and continuous improvement. Our purpose is integration. We want to understand how these tools, when properly integrated, not only help us face the challenges of the health system, but also improve the patient experience and institutional efficiency. A guiding philosophy. As we state in the book, managing a hospital is not just about administering beds and budgets. It is also about building environments where life and dignity are protected with science, ethics, and strategy. A note on scope. It is important to clarify that what we will see here is an introduction. Even in the accompanying book, where these topics are expanded upon, the content remains an approach to the most critical elements of hospital management. This field is vast and complex. Our goal is to provide you with the essential framework to understand the challenges of the real world, rather than an exhaustive instruction manual. Every hospital needs a clear direction. That is precisely the goal of strategic planning. To anticipate needs, define clear objectives, align resources, and establish paths of action that give purpose to every decision. We must ask ourselves, what is the point of expanding a department if there is no real demand? Or hiring more staff if the actual workload is unknown? Planning allows us to respond based on data, not merely on perceptions or the pressures of the moment. In the Mexican context, often characterized by high demand and limited resources, effective strategic planning must be realistic and flexible. But above all, it must be built with the active participation of those who live the hospital reality day in and day out. However, having a plan is not enough. It is also necessary to properly organize medical services. This implies defining hierarchies, assigning responsibilities, and establishing clear workflows. The key lies in structure. It requires functional organizational charts, updated clinical protocols, and organizational manuals that ensure coherence across all areas. A well-structured organization prevents duplication, reduces errors, and improves coordination. And let's remember one crucial point. An efficient organization is not synonymous with rigidity. Rather, it is the capacity to adapt with order to the constant changes and needs of medical care. In a hospital setting, leadership is not confined to executive titles. It also lives in the corridors, across shifts, and in every clinical or administrative decision made with responsibility and vision. A good leader in healthcare knows how to listen, communicate, and resolve conflicts. But above all, they know how to motivate the team toward a common goal: providing care that is safe, efficient, and humane. Effective leadership manifests at every level, from general management handling major capital to the department head organizing rosters or the nurse coordinating processes with excellence. But how does this relate to resource optimization? To optimize does not mean to simply cut back. It means the intelligent use of personnel, supplies, time, and infrastructure. It is about reducing waste, digitizing processes, and prioritizing what truly adds clinical value. For instance, scheduling surgeries by accounting for turnover times or assigning shifts based on actual demand rather than habit. The result is balance. When visionary leadership meets efficient management, it is possible to improve clinical outcomes without compromising financial sustainability. In fact, the best organized hospitals are often the ones providing the best care. Managing a hospital cannot be done from a single office. It requires dialogue, constant review, and collegiate decision-making. This is exactly where hospital committees come into play. These interdisciplinary bodies are fundamental. Their role is to supervise, evaluate, and advise on critical aspects of hospital operations. They do not exist merely to satisfy paperwork requirements or check a box. They exist to provide evidence, prevent risks, and drive concrete improvements. Who makes up a committee? Physicians, nurses, administrative staff, and in some cases, even patients or external representatives. Everyone has a voice, allowing for solutions to be built from diverse perspectives. Their scope is broad and critical. It ranges from reviewing protocols to analyzing adverse events, healthcare-associated infections, or clinical performance indicators. They act as internal control mechanisms that strengthen the culture of safety and improve coordination between different departments. But there is one thing we cannot forget. A committee that fails to meet, that does not analyze data, or that fails to propose actions, is nothing more than a simulation. In a hospital, leadership is not the exclusive domain of a single figure. It is distributed across various levels, all interconnected and all absolutely necessary. Let's start with general management. This role sets the institutional vision. They manage resources, serve as the legal representative of the hospital, and make the high-level strategic decisions. Then we have medical management. In contrast to the general administration, this role focuses entirely on clinical operations. They coordinate services, supervise the quality of care, and evaluate professional performance. Moving to the operational core, we find the service chiefs or department heads. They hold a key operational function. They are the ones organizing shifts, validating protocols, and resolving the daily conflicts that arise on the floor. But we must not overlook functional or transversal leadership. These are individuals who may not hold a traditional hierarchical rank, yet from areas such as quality, patient safety, or teaching, they manage to transform the hospital from the inside out. So, who truly leads in a hospital? The answer is anyone who inspires, organizes, and improves. Leadership is not just about command. In healthcare, leading is not just about giving orders. It is about influencing with ethics, coordinating with purpose, and transforming with vision. The result of articulated leadership, a hospital with articulated leadership, shared objectives, and effective communication, is a hospital capable of sustaining its clinical governance and achieving continuous improvement. To make a committee work, having a list of names is not enough. It requires a clear, formal, and operational structure. Generally, every committee relies on three key figures: a president, who coordinates the group's work; a technical secretary, responsible for convening meetings, organizing the agenda, and ensuring follow-up; and a group of members, or vocales, encompassing both clinical and administrative staff, who have a voice and a vote depending on the topic at hand. But beyond titles, the essential element is functionality. We must ask, do they meet periodically? Do they analyze adverse events? Do they actually propose improvement actions? Their basic functions are critical to the operation. These include monitoring compliance with standards, reviewing deviations in clinical or administrative processes, and delivering useful, actionable reports to the directorate. Crucially, they must issue clear, practical, and measurable recommendations. The goal is not merely to register problems, but to offer solutions, formalizing the process. Additionally, every committee must possess its founding charter, internal regulations, and a defined session schedule. In summary, a committee is a powerful management tool, but it only functions if it possesses two things: structure and the will to act. Committees are not optional suggestions. Beyond their utility, many hospital committees are mandatory by law or regulation. Failing to establish them, or having them exist only on paper without activity, can lead to serious legal or regulatory consequences. Let's look at some key examples. 1. The Quality and Patient Safety Committee. This is arguably one of the most critical bodies. It is responsible for analyzing adverse events, reviewing performance indicators, and driving actions for continuous improvement. 2. The Hospital Ethics Committee. This committee evaluates complex ethical clinical dilemmas. It guides difficult decision-making processes and safeguards the fundamental principle of patient autonomy. 3. The Medical Records Committee, Comité de Expediente Clínico. Its role is to supervise that clinical files are complete, up-to-date, and confidential. We must remember, poor record integration compromises both the quality of care and the hospital's legal defense. 4th, the Pharmacy and Therapeutics Committee. This body evaluates the rational use of medicines and updates the hospital's basic formulary. Poor selection or prescription guidelines can lead to serious medication errors. 5th, the Committee for Healthcare-Associated Infections, Infection Control. It monitors infections acquired during medical care and coordinates essential prevention and control programs. Operational discipline. All these committees must operate with regularity, formally record their agreements, minutes, and form an active part of the hospital's clinical governance. The bottom line, a hospital operating without these committees is a hospital sailing without a compass. Quality of care does not depend solely on resources, protocols, or technology. It also depends, significantly, on institutional culture. But what exactly is this culture? It is the set of values, beliefs, and practices shared by everyone working within the hospital. It is the force that enables people to act ethically, work as a cohesive team, and prioritize the patient above all else. A strong culture promotes collaboration, transparency, and respect. But beyond that, it sustains fundamental processes such as patient safety and continuous improvement. However, that culture must be complemented by an essential principle: evidence-based decision-making. In hospital management, it is no longer enough to say, that's how we've always done it. We need data, indicators, clinical results, as well as guidelines, scientific literature, and official standards. Deciding with evidence means, for example, assigning shifts based on the actual workload, prioritizing purchases based on cost-benefit analysis, or redesigning processes based on error rates rather than intuition. Let's remember this core concept. Without evidence, management is based on assumptions. And without institutional culture, any change loses its direction. To discuss hospital management in Mexico is to acknowledge reality. It implies recognizing the real challenges facing our healthcare system today. One of the primary hurdles is limited and often outdated infrastructure. This is particularly acute in secondary-level hospitals and rural areas, where optimal conditions for safe care are not always guaranteed. Added to this is the lack of digital integration. Most hospitals lack robust clinical systems or electronic medical records. This severely hinders patient tracking, continuity of care, and the ability to evaluate clinical outcomes effectively. Another constant challenge is staff turnover and a scarcity of management-trained leaders. Frequently, clinical department heads have not received formal training in hospital administration. This gap limits their ability to coordinate teams and make necessary strategic decisions. We also cannot ignore budgetary pressures. The lack of investment in maintenance, supplies, or training constrains our ability to improve processes or drive innovation. Finally, the Mexican healthcare system suffers from deep fragmentation. Each institution operates with its own protocols, platforms, and rules, making interinstitutional coordination incredibly difficult. Overcoming these challenges will not happen overnight, but it requires more than just financial resources. It demands visionary leadership, regulatory strengthening, and a culture truly centered on the patient. Managing a hospital is not merely about meeting schedules, budgets, or operational targets. It is much more than that. It is an extended clinical act. It is a form of caring before, during, and after direct contact with the patient takes place. Because every administrative decision has a real impact. It impacts safety, quality, and the dignity with which people are treated. Throughout this module, we have discussed planning, leadership, committees, institutional culture, and evidence. And all of this converges on a simple, yet profound idea. Management is the terrain where medicine becomes possible. Without good management, the foundation crumbles. Without it, there are insufficient resources, there is no effective organization, and there is no way to sustain care that is ethically or technically sound. That is why we say that, in healthcare, to manage is also to care. And we only care well when we manage with evidence, with structure, and with humanity.